Rockingham County has about 90,000 people. We have an aging population. We also have a lot of children. Until recently, Rockingham County was a robust county. We were largely a tobacco and textile industry, and we lost the tobacco industry in the mid-90s and the textile industry not long after that. So we went from being a wealthy county to a poor county very quickly. I can't overstate how important the county health rankings have been to our work. When they were released in 2010, I think our entire community, there was a collective intake of breath. We were really surprised at how low we were in the rankings. That was a real wake-up call for us. But a few years later, the Kate B. Reynolds Charitable Trust became involved with our community, and we started to expand the conversation even more. And we started to look at health as more than simply healthcare access.
Well, health and well-being are more than health care. And we don't believe that these communities chose to be unhealthy, just as we don't believe these communities or those people chose to be poor or financially needy.
One of our critical partners has been the Rockingham Business and Technology Center. They have spearheaded some really innovative projects to encourage healthy living and healthy economy, one of which is the virtual farmers market.
The virtual farmers market was an initiative to try to give local farmers a new market for their products that they didn't have access to before.
I have an herb farm, and I am able to post my herbs on the internet.
For Rockingham County, the impact on the local farmers, I think, has been tremendous. One, that expanded the farmers' reach for their customers, but two, it provided them an education on how to reach out using technology as a means for their marketing and sales. When we have successful businesses, successful farmers, what that does for the health of Rockingham County is gives them livelihoods, gives them access to capital, to money that they can invest in themselves.
We have a really exciting project underway in the Clara F. Dunn Community Health Center. That's an innovative partnership between Triad Adult and Pediatric Medicine and the new Reedsville Public Housing Authority.
We're still in the final stages of renovations, as you see, so as soon as we get the tile down, get the cabinets installed, we'll be able to bring the equipment in and get everything ready. So it'll be a full-scale primary care facility. We have 3 exam rooms, a small lab space. This site was ideal because if you don't have a car, well, you likely can just walk down the road and come and see us for your primary care.
Another program that we are eagerly anticipating is the Nurse Family Partnership Program, which will launch this spring in Rockingham County. It's a program that pairs home visiting nurses with at-risk moms and children up until the age of 2. They provide a range of support to both moms and babies.
Yes! It's a strong rapport that's built between the mother and the nurse, and that's really the core of the program.
Just having that person that you can reach out to was the best thing to me.
The outcomes we know that we've seen from other programs show that incredible gains in terms of children's development, incredible gains in terms of mother self-sufficiency, the ability to support themselves financially, the ability to complete their education, and those are all things that we know could really help the overall wellness of our community.
Health is important, but it's hard to be healthy when you're not stable, when you are not sure how you're going to keep the lights on, and when you're not sure if your job's going to be there next month. This isn't a problem that our healthcare sector can solve. It's not a problem that our faith sector can solve or that our business community can solve. It's a complex problem that's going to take input from all of those, as well as community members and residents.